Welcome to the OVERS training for birth information specialists and midwives. This is the home page for OVERS. Once you receive a username and password, this is where you'll sign into the OVERS system so you can start entering birth records. So I'm just going to sign in as my test birth information specialist. You will be taken to the user acknowledgement screen. You'll want to read through the acknowledgement and then click I accept. Along the top, you'll see several tabs with drop-down options. And in the center of the page, you'll see fast links. Now, these links will only appear after you've entered some birth records from the links above. So the first thing I'm going to do is enter a birth record. And to do that, you would go to Birth and then Start, Edit, New Case. Now, OVERS will have you search for a case to see if the record's already in the system. So what you want to do is enter as much information as you have. So you would enter the child's name, and in this case, I'm just going to put in a last name. After entering the child's name, enter the birth date. That can be typed in, or you can also click on the calendar icon to select the date there. After entering the date, select the sex of the child, and then click Search. What will come up is the birth search results, and in this case, there are no cases that match the criteria that we entered. So you can go ahead and start a new case. But what I'm going to do is show you how to locate a case that's already in the system, because I've already started one and we've got some information already entered for you. So to find a case that's already in the system, you would go to Life Events, Birth, and then Locate Case. Now this looks very similar to what we saw earlier, but you can see that the date of birth and the sex are not required fields when you're searching for a case that's already in the system. I'm going to just type in our test last name and then click the search at the bottom of the page. On the birth search results, you'll get a list of cases that match the information that you entered. And there are several ways to sort this information. You can sort by date of birth, place of birth, child's name. I'm just going to sort by date of birth to get the test case that we're going to look at. So we're going to go into the test case that I've already created. So I'm clicking on Nina Test, the child's name at the top. And what you'll see is the birth registration menu. And the menu is broken into two sections. So we have the parent information at the top, and then we have the facility information below that. So on this first page, the child page, we have the child's name, we have the birth date, the time of birth, the sex of the child. And on the sex of the child, you can see we have a drop-down menu, so there are several drop-down menus within OVERS. The next field is a request for social security number. So whether or not the parents would like a social security number, we go ahead and select that. And once this page is filled out, then you just click Next. And that'll take us to the mother page. So I have already entered some information on this case just so we can go through the screens a little quicker. But you can see we've got the mother's first and last name, and then below that the first and last name and middle name from before the first marriage. So if the mother has the same name, you can always just click Copy Current Legal Name, or if they were married, then you could put their maiden name in. Next, we have the mom's date of birth, And again, you can just go ahead and type that information in, or you can click on the calendar to enter that information. The age field, you actually don't need to type that in. All you have to do is click on the arrow, and it will automatically populate the age for you. The next field is for Social Security number, so you can go ahead and type that number in. If she doesn't have a Social Security number, you can select none, and it will populate all zeros for you. Or if you select unknown, it'll put in all nines. Next is the mother's birthplace. So we have the birthplace state and country. And we also have a new icon we haven't seen yet before, and that's the house icon. And if you click on that icon, you can use a drop down to find different countries. So United States is listed first, and then all the other countries are listed alphabetically. And you can also select the state from the drop-down menu. After everything is entered in here, then you just click Next, and that'll take us to the mother address page. And the mother address, just go ahead and type her address in, and make sure you make a selection for whether or not she's inside city limits. And if the mailing address is the same as the residence address, just put a check mark in this box, and it will populate that information in there for you. Otherwise, just go ahead and type in her mailing address. This is the Mother Demographics page, and at the top of the page you have the education question, and there is a drop-down to select from. The next questions cover mother race and ethnicity. So the first one is, how do you identify your race, ethnicity, tribal affiliation, country of origin, or ancestry? So there is a text box on the parent worksheet, so just type in what the parent entered there, or if they left that blank, you can just select did not answer. Right below that, we have which of the following describes your racial or ethnic identity. Please check all that apply. And again, you would just select all the boxes that the parent selected on the worksheet. Now within these categories, we have all these check boxes, and you'll have several other specify boxes. So if the parent selected other Pacific Islander, for example, and you click in that box, then you can go ahead and write or type in whatever the parent put on the worksheet. Now, if they didn't write anything on the worksheet, but they did select other specify, you can just type in not specified because they didn't provide you with an answer. Now, in the American Indian or Alaska Native category, if the parent selected any of these boxes, you will also have to click specify tribes and then type in the tribe that's listed. Now, we do have several tribes already built into the drop-down, but if the tribe that the parent belongs to is not listed, you can just go ahead and type that in. Again, just like above, if they selected American Indian, but they didn't tell you which tribe, then you would type in not specified. And then as you scroll down, we do have a couple of other options. And we have a not listed, please specify. So if none of the categories fit what the parent considers themselves, they can go ahead and on the parent worksheet, type in what their racial or ethnic identity is. So here's the field to do that. Now, if none of the boxes were checked, there are some opt-out options. So the parent could have selected don't know, don't want to answer. And if they didn't answer this question at all, so none of the checkboxes were selected, then you can select did not answer. The next question covers the parent's primary racial or ethnic identity. On the worksheet, the parents select the different options under the racial or ethnic identity categories. And if they consider one as their primary on the worksheet, they will circle that option. The birth information specialist will go to this question and select yes if the parents selected yes on the worksheet. The other options are I don't have just one primary racial or ethnic identity. No, I identify as biracial or multiracial. NA, I only checked one category above. Don't know, don't want to answer, and did not answer. So if the parent did have more than one of the checkboxes checked, you would open up this drop-down and then go ahead and select yes. And a new text box will appear where you'll be able to choose the primary racial or ethnic identity that the parent circled on the parent worksheet. Now, if you have forgotten to check one of the boxes that was on the parent worksheet, and for this example, we'll just put in Korean here, and then you go back to choose the primary racial or ethnic identity, the box that you just checked will not appear. So in order to make that box appear, you do have to refresh this question. And to do that, you click on the drop-down and click in the blank space, and that'll go ahead and refresh the question. And then you select yes again. And then the drop-down will now include the box that you added after you had originally added boxes. The last thing on this page is the language questions. So we want to know what language or languages the mom or the father, second parent, speak at home. And we have drop-down options to select. And if they didn't answer this question, if you scroll down, you can see the don't want to answer or don't know option. Or if they left this completely blank, we do have a did not answer. Now, the remaining language questions are only required if the mom or second parent didn't speak English at home or didn't speak only English, American Sign Language, or sign language at home. So if the parent spoke an additional language at home, or perhaps maybe they only spoke Spanish at home, then you would fill out the remaining questions that pertain to language. The next page is the mother disability page, and there are several questions on this page, and each question has a drop down where you can select the answer that the parent put on the parent worksheet. So you can see we have options of yes, no, don't want to answer, and did not answer. Now for two of these questions, there's an additional option, which is don't know what this question is asking. Also, the last two questions will only need to be answered for those parents that are age 15 years old or older. So those will be grayed out if the parent's under 15. Now, if the answer is yes, a new text box will open, and it asks, if yes, at what age did this condition begin? So you just go ahead and type in whatever the parent put on the parent worksheet. If they left this question blank, then you can just put in 999 for unknown. After answering all of these questions, we'll go to the next page, and that'll take us to the mother health page. And on this page, you'll have some questions like whether or not mom got WIC for herself during this pregnancy. So you can just go ahead and type or enter in that information. Information about height and mother pre-pregnancy weight and mother weight at delivery. So we can just go ahead and enter that information. Next will be questions about cigarette smoking, so whether or not the mom used tobacco using this pregnancy. Next, is about alcohol use, so you can put in whether or not mom used alcohol while pregnant. You also have a question about whether or not mom went into labor intending to deliver at home or a freestanding birthing center. So we'll just select that from, and again, that information should be on the parent worksheet. And we'll click next, and that'll take us to the marital status page. On this page, you'll indicate whether or not mom was married at conception, at birth, or within 300 days prior to birth. Now, if you select yes, and I'm just going to save that, then you will get several new pages that appear on the birth record. So you'll get the father page, you'll get the father second parent demographics page, and the father second parent disability page. Now, these 3 pages mirror what's on the mother page, mother demographics, and mother disability page. So the same questions on all of those pages, and they match the mother and the father matches up. So if you selected yes, those pages will appear. If you select no, and we'll save this, then those pages will no longer show on the menu, but you'll get a new question that needs to be answered about paternity, asking if the acknowledgement of paternity has been signed at the hospital. If it has, then you will also have the father and father second parent pages. If there has not been an acknowledgement of paternity signed at the hospital, and we'll put save that, then you will not have those father pages. And again, those father pages mirror what's on the mother pages. You'll also have a question about how they would like the mother, father, or parent field to display on the birth certificate. So you can go ahead and select that. After finishing the marital status information, if there's no father on the record, you'll be taken to the informant page. For the informant, you have a drop-down, and if you select mother, the mother information will be populated, or father if there's father on the record. There's also an option for other, where you can go ahead and type in the other relationship. And that's the end of the parent information section. Once you click next, you'll be taken to the facility information section, and the place of birth is the first page in that section. The place of birth page will have your facility information defaulted. Just to check to make sure it's correct, and if it is, go ahead and click next. That'll take us to the prenatal page. And on this page, the first field is the mother medical record number, and then after that is the mother Medicaid number. Principal source of payment for this delivery, so just make sure and select what type of payment the parents are using for the birth and the delivery. This is also where you'd put the date of last menses, and whether they had prenatal care or not, and the date of the first visit, any previous live births, and the total number of pregnancy outcomes. So go ahead and enter all that information from the drop-down. The next page includes pregnancy factors. So there are several risk factors that are show on the page. If any of those apply, just go ahead and check them. If not, just remember to click none of the above. We also have some information about whether or not the mom was tested for syphilis or for strep, or any of these infections were present. And in this case, make sure and select none of the above. You'd also enter any obstetric procedures that were conducted. Once everything is filled in on this page, then we'll go to the next page, which is the labor page. And on the labor page, list any characteristics of labor and delivery. And you can again check all that apply or none of the above if none were performed. The next page covers delivery, so method of delivery. And on this page, you may have some items that are grayed out, and that's because they just don't apply. So you would put in the fetal presentation at birth, final route and method of delivery. And if there are any maternal morbidity items, you can go ahead and check those, or if nothing applies, just none of the above. And put in whether or not mom was transferred, or if the infant was transferred. The next page is the newborn page, and this is where you put in the newborn medical record, weight, APGAR score, whether or not the birth was a plural birth. So here you would enter single, twin, triplet, and so on. If it was single, then the birth order would be grayed out because it's not applicable. And then you would enter whether or not the infant was living at the time of the report or if they're being breastfed at discharge. Next is the newborn factors page. So if any of the conditions apply, so abnormal conditions of the newborn or any congenital anomalies, again, you can go ahead and check all that apply or none of the above. The next page is the Attendant Certifier page, and the certifier information will be listed at the bottom. And the attendant is listed at the top. So to enter in an attendant, what you would want to do is click on the lookup tool and then type in a couple of letters of the attendant's last name and then use the wildcard, which is our %, to do this search. When you use the wildcard, that % will take the place of any of the remaining letters of the name, and it's usually easiest to find an attendant this way. That way you don't need to worry about misspellings on the name. So anyone who meets that criteria will come up in the search, and then you just select the attendant from the list, and then their information will be populated for you. Once you click Validate Page, you'll notice on the left-hand menu that you'll have green check marks, so that means everything on that page is complete. And then we do have two types of errors. The first one is a red X, and that one represents a hard edit, which means the error must be corrected. And the other type of error that you'll come across is a yellow caution sign. We call that a soft edit because that error can be overridden. So let's take a look at these two types. I'm first going to go to the newborn page that has a soft edit or the yellow caution sign. And the error is going to be highlighted, so you can see it's highlighted in yellow. And if you look at the bottom of the page, you'll get the error message. And this is telling us that the difference between the calculated gestation and the estimated gestation cannot be more than 4 weeks. Well, this will happen on occasion if the mother maybe had irregular periods. So we want to keep this as is. This is the doctor's estimate of gestation, so we can override this error. And to do that, you can click on the box underneath where it says Override, and then click Save Overrides. That'll keep the information in that field as is. So I'll click Save Overrides, and the page will refresh. And now we can go look at the hard edit, or the red X, that's showing on the Mother Disability page. Again, the error is highlighted, this time in red, and we can see what's missing. In this field, we selected yes for the mother disability, and if yes, at what age did this condition begin, is blank. So we'll look at the parent worksheet, see what the parent wrote in this field, and go ahead and enter the age that was on the parent worksheet. This page also has the error message listed at the bottom of the page, and you can see that we do not have the option to override this error because there's no override checkbox. So now once we've corrected all the errors, we do need to go through the error checking process one more time to make sure the entire record is complete. I'm going to click Validate Page, and again, Validate Page is the error checking on the entire record, not necessarily on any specific page. Now, if you'll notice on the left-hand side, we now have green check marks all the way down, and Mother Disability has a green check mark. Now, the newborn page still has the yellow caution sign, and that's okay. That just indicates that an error on that page was overridden, and you'll know that everything is correct because now you have a new link, the Certify link. Whenever an error is overridden, like we did on the newborn page, go ahead and leave a comment on the record to let us know why the error was overridden. So you just click on Comments and then New Comment. Comment type will just be General Comments, and then just put in why you overrode the error. So in this case, it could be that the periods were irregular, or whatever the case may be. Just put in why the error was overridden and click Save. That way we know at the Center for Health Statistics why an error was overridden. So I'll just click Close. And now we're ready to certify the record by clicking on the Certify link. Once you click on the Certify link, you'll be taken to the Certify page that has two affirmation statements. The first one is, I affirm under the penalty of perjury that I'm the authorized certifier whose name will appear on this certificate, and I certify that this child was born alive at the place and time and on the date stated. Place check marks next to these statements and then click the Affirm button. Once you click the Affirm button, you'll get the Authentication Successful message. The record is now certified.